Hello, my name is Dr. Raina Remigio, and I am a clinical psychologist with the Integrated Behavioral Health Clinic, which is part of the Innovative Care Clinic, the Adult Primary Care of San Mateo Medical Center.
My name is Dr. Debbie Alexander, and this is a presentation that we gave to patients here at the hospital. Wanted to know how to care for yourself as a caregiver, and wanted to offer this to you as well.
Right, and so we pulled information from different resources like the Alzheimer's Disease International Organization, Family Caregiver Alliance, Mental Health America, and so many others, and we'll have links at the end and in some of the slides to show where we retrieve the information. But we just wanted to put it together so that our patients can have one place to start, with all the info, and then can sort of go and research the links when there's time. We also wanted to mention that this was, as Dr. Alexander had mentioned, this was offered as a class. It's information that will hopefully provide some support to all of you caregivers out there, and that we recommend speaking with your primary care provider or counselor for additional support and recommendations. Anything else to add to that? Okay. So we'll start off just by talking about a little bit of background info on caregivers, and then we'll move into talking about caregiver stress and burnout, and then we'll also cover a little bit about dementia, which can be an issue that comes up when providing care to older adults. Not everybody gets dementia, but when dementia is a factor, it can sort of create added stress and can be tricky to navigate. So we wanted to have a starting off point where you might be able to get some strategies on how to work with it, to alleviate some of that stress. And then again, we have those resources where you can get more information. Okay. So before we jump into the background info, we wanted to express a lot of gratitude to all of you who are now on the caregiving journey. There's a quote here from Edward Albert: "The simple act of caring is heroic." And so thank you so much for all that you do. Okay, so a little background info about caregivers. The way that we're talking about caregivers in this class is someone who is responsible for attending to the daily needs of a family member, friend, neighbor. And we're talking about caregivers in the informal sense, so unpaid, non-professional, and that these people are taking care of others with helping them with their daily needs. That might include physical, emotional, or financial needs. Here we're going to refer to the person receiving the care as the care recipient. And we also wanted to sort of just highlight that there are many different and unique circumstances that lead people to becoming caregivers. Like, for instance, a family, a friend, or a neighbor may have become ill or had an injury and they need help with their activities of daily living. And also, these caregiving responsibilities can be short-term, long-term, or indefinite.
And many times people tell us that they become a caregiver by default only because there's not the financial resources to take the care recipient to a full-time care facility or have someone come in the home. And it basically falls upon these family members whether they can manage it well or not. And that's one of the reasons we wanted to have this workshop, was if this happens to you and this is the only resource that the family has to care for this person, we want you to learn how to take care of yourself as well.
Mm-hmm. And one of the reasons that we wanted to offer this as a video recording, which we don't typically do for our wellness classes, is because 85% of caregivers usually do not get a break and cannot leave to attend a class, or to go and get a massage or do some other sort of self-care. And 1 out of 5 people in the US, which is approximately 60 million people, are unpaid caregivers. And over half of caregivers experience high emotional stress, with about 34% of caregivers reporting a decrease in health while caregiving. Which brings us to wanting to address that piece. And so we want to talk a little bit more now about caregiver stress and burnout.
So how do you know when you're getting burned out and when the stress level is too high? The screen has some ideas that may be a signal for you. Basically, you could be experiencing denial and feeling like it's not a problem, or you are not overwhelmed, or that this is not happening in your life. You may actually feel a little bit angry toward this person you're caring for, or angry at other family members for not stepping up and helping, or even angry at yourself for feeling like you're failing in your role. Some people feel burned out and they start to withdraw from the public socially. They stop going to church or going to cultural gatherings or family meetings because they just feel overwhelmed and feel that they're not doing the best that they can do. A lot of people engage in activities that used to be fun and they just are not enjoying them anymore, or they can't concentrate on what's happening around them, whether it's a TV show or reading a book, something like that. People tell us a lot of times that they're just completely exhausted all the time. They go to bed tired, they wake up tired, and they go through their day tired, not only physically, but emotionally. Emotional exhaustion can lead to feeling tearful all the time, or maybe even shut off emotionally, like you don't have any reactions to anything. People have told us that they feel anxious or depressed, discouraged, worrying. They can't sleep at night worrying about their loved one. They might feel a little bit testy, irritable, or short of patience with other family members, or even the person they're caring for, or a sense of hopelessness that this is never going to be over. This loved one is never going to be able to go anywhere else but here. Again, like I said, they can't concentrate, they're forgetful, they're losing things, they're not able to remember what they were thinking or doing. People express caregiver stress in their bodies. Their body can give them a message that is too much stress by getting sick. They're catching colds or getting flus or having digestive difficulties. Some people start to turn to food for comfort and coping with stress. They'll begin to gain weight, or they might just not even have any appetite at all because they're so concerned about their loved ones. Some people do start to manage their stress by using and abusing alcohol or other substances. And then there are people who reach this level of hopelessness where they want to hurt themselves or the person that they're caring for.
And we want to just spend a moment on that last piece right there, that having the thoughts, it's not uncommon for the thoughts or the feeling to come up. But it is a sign that, it's really become very overwhelming. And so we want to provide the National Suicide Prevention phone number and also their crisis text line. It's free, it's 24/7, it's confidential. So when you start to notice, this, especially if you don't have a lot of support around you, or again, like anytime in the middle of the night, whatever, please give them a call, and they can provide some support.
And we just want to add that having those types of thoughts can be very difficult when they happen. A lot of people think that they're the only ones having those thoughts, but we want to suggest that you consider that that is very common when people are overwhelmed. I like to say that it's a normal human reaction to an abnormal level of stress. in that you're just overwhelmed and you feel no hope. And that's what's important to reach out for help.
The other number that we'd like to give you all is the, I think they call it the ties line, but basically it's a number that anybody can call when they are suspecting any dependent or older adult abuse. And there are different types of abuse. Would you like to go?
Yeah, we always think of physical abuse, but it's important to know that statistically there's a lot of financial abuse of elders. There's also sexual abuse, and there can be just sheer neglect where the loved one is not being bathed regularly or has difficulty eating and is not being fed, those types of things. Again, this phone number that you're seeing on the screen, that is a confidential line. Feel free to call, even if you just suspect that something could be happening to your loved one.
Okay, so let's dive into a little bit of dementia, which can come up when caring for an older adult.
So dementia has some warning signs. It typically can start very subtly within an older person's life. And if you look at your screen, there are some 10 key signs that this may be happening. The first one, of course, is memory loss, and this could be the short-term memory specifically, including where they left things or just their daily procedures. It can go also to difficulty performing familiar tasks, and this is more of the crystallized information from their past. They may forget how to cook or how to find their way home, or they may forget typical tasks that they do every day. And that can increase in severity as the disease progresses in their brain. They can have trouble with languages. It's kind of, we call it the tip of the tongue problem, where they may substitute a word for another word or invert the order or not have the correct grammar. They can be disoriented in time and place. They might not know what day of the week it is. They may not be sure why they're there. They may not be aware of even what year it is or the season. They can show poor or decreased judgment, and this is from the prefrontal cortex, which manages appropriate behavior. So they may make choices that they would not have made before as far as what they wear or what they say. You may hear things that will surprise you. It's important to keep in mind that that is the dementia, that is not your loved one who is saying and doing those things. They have trouble with keeping track of things. Number 6, they lose things, they misplace things. That's also number 7. Number 8, a lot of people in these stages will have a kind of a personality change. They may become more aggressive, or they may become more emotional. They may become more angry, and that again is the disease talking, not your loved one. They may have trouble with spatial relationships and images, and I've learned that that is when you see the tentativeness, for example, with them stepping up onto a curb or sitting down on a couch. It's not so much a motor problem with their legs or their bodies, but they are literally unable to tell how far up to step or how far down to sit. The spatial relationship is missing. And then there is a lot of shame and withdrawal from work or social activities. Many people in the early stages are aware that they are starting to see these things happen, and they're embarrassed by the process and feeling like they may say something that embarrasses them or you.
And please note that, as I mentioned, dementia is something that can come up when caring for an older adult, but it's not always the case. Dementia is not a part of normal aging. And so please talk to a doctor or contact the Alzheimer's Association in your country or county. They're everywhere, it's international. I also wanted to provide a little information, because we often get the question of what's the difference between Alzheimer's and dementia. And basically dementia is a really broad category that encompasses some of these behavioral and mood changes that Dr. Alexander just reviewed. And Alzheimer's is a type of dementia, but it is of the dementias, it is the one that is most common. And there are other types as well. Okay, so let's talk about some strategies on how we can sort of care for ourselves as caregivers to help reduce the burnout or prevent the burnout or come back from an episode of being burnt out a little bit more quickly. So some general strategies for caregiver self-care you can see here in the infographic. It's asking for help, setting boundaries, taking some, putting yourself first. And that's not a selfish thing, but it's kind of like that metaphor of, that's often used when you're riding, flying in an airplane. If the oxygen mask comes down, you want to put the oxygen mask on yourself first before helping children or other people. And the reason for that is because if we're not well, then it's going to be really difficult to help somebody else, and then we may not really be able to provide them the care. And in some cases, it could be harmful to the care recipient. According to Mental Health America, the top 3 most helpful self-care strategies have been prayer, talking to others, and reading. And prayer, that's can be any form, not tied to any specific religion. Could be sort of like meditation or mindfulness can be a form of prayer, or just a gratitude type of practice. Do you want to add more to?
I think we got that covered.
Okay.
So we have some strategies that we have on this slide that may be helpful in your day-to-day interactions with the person for whom you're caring. It's really important to use straightforward, simple questions about what is happening. For example, if you're taking them to the hairdresser and you give them a lot of information about how you're getting there and what's going to happen and that sort of thing. Too much information can be overwhelming in that state. Very simple sentences. Using redirection can be very helpful, especially if they become upset or frustrated or emotional, and they tend to ruminate on the same topic or the same question over and over, to kind of get them out of that loop of asking something over and over or trying to understand something that's beyond their capacity. It's just much simpler to redirect them to a TV show or to a cat that's in the house or to something else, and then just send them in a different path to get them out of that stuck place. Compassion is so important, not only toward the person you're caring for, but toward yourself. And having that sense of, how would I want to be treated in this situation? The next one is interesting. It's called therapeutic lying. And in the class, we were talking about how that a person you're caring for may, for example, think that it's Thursday 3 times that week. You can argue with them about that, and they might become very, very upset. What is it going to harm them to believe that it's again Thursday? Sometimes it's better and more compassionate to just agree with them that yes, today is Thursday. As long as they're not hurting themselves or going outside, it's fine to just kind of dissuade them from that path. Modifying the environment can be very helpful. For example, a large calendar with a day of the week. If you have access to windows in their room, you want to open the curtains so that they understand day and night. Again, so hopefully they will be sleeping at night. The sundowner effect is true, where they tend to be more confused later in the day. And if they switch their sleeping schedules to the daytime, it's going to create difficulties with their memory and their awareness and concentration. It's important to talk to their doctor about what's happening at home and ask questions. For example, a lot of times people can look very, very confused suddenly, and it could be due to something else that's happened, whether it's a small stroke or a UTI, but keep the doctor in the loop on what's happening at home. Ask for help early. It's very important to schedule, for example, schedule a family meeting to discuss their care, have a phone conference if your family members don't live nearby, but basically communicate with your family. My work in this area, I've found that a lot of people feel frustrated because they are related, they want to help with the loved one, but they don't know what's needed. And so you as a primary caregiver would be helped and greatly by actually saying what is needed. Bring the grandchildren and great-grandchildren over. Give you a break. Have a phone conference or Skype or FaceTime with the loved one. Basically ask for help. A daily schedule for your loved one can be very helpful, including where you will be if you have to leave the house, your schedule, and your phone number. In our family, we had 3 copies of it and would have it posted in conspicuous places so our loved one could know again and again that their caregiver is gone to work or gone to the store and will be back at this time. And more than one contact phone number would be helpful, especially if they're confused, not remembering who they're calling, or not getting in a hold of you right away. And just keep in mind that their functioning can change each day. You may have a very good day where you think that this person is getting better and they're recovering, and then the next day can be very, very bad. It's just the nature of the disease. It can fluctuate. It's important to adjust to that functioning as it changes.
Yes, and I want to sort of emphasize that because I have worked with families who feel really frustrated and even hurt in thinking that the care recipient who has dementia is just lying to them or playing dumb, and but it's really more that the person with the dementia is just having a fluctuating level of functioning, which could be impacted by so many different things. And so to just keep that in mind as well. Okay, so let's talk a little bit about a few exercises that we can do just throughout the day, even during our caregiving responsibilities. One of them is to practice self-compassion. This is an infographic taken from seeyourwords.com. Kristen Neff, she is a big proponent of self-compassion. As you can see here that, it's a source of strength and resilience. It's acknowledging our suffering without exaggerating it, and acknowledging that there is suffering not just here with ourselves or difficulty, but also that the person, the care recipient, is also struggling. And even though we may know that, sometimes when we are stressed, we can kind of lose sight of that. And self-kindness is also part of this self-compassion. So being as kind and caring toward ourselves as we are to others. A few other exercises, one of which we will get into, are some breathing and relaxation exercises. On the left side, you see the little character doing diaphragmatic breathing, where they're inhaling and inflating their belly like a balloon. And then as they exhale, they're sort of pulling their belly button back towards their spine to expel all the air. And you may try that to a count of like 5 in and 5 out, or you may play with a count of 3 as you inhale, count of 4 as you exhale. And this is something that can be done in really like a minute or a few minutes, and can notice some benefit from that. And it's something you could also do with your care recipient. The one on the right is a muscle relaxation exercise, and you can do it sitting down or lying down. Also another thing that you may possibly be able to do with the care recipient, and you basically tense and relax different muscle groups in your body. And Dr. Alexander is going to give us a demonstration of another type of breathing relaxation exercise.
So I'm just going to explain how to do it, and you can try this on your own. Basically, what we'd like you to do is to envision a box suspended in the air in your line of vision, and you're going to time your breathing according to the size of the box. This is just a way to slow yourself down when you feel like you may be breathing very quickly because of anxiety, or maybe even regulating your breath a little bit more. So what you're going to do is trace the outside of the box and time your breathing according to the 4 sides of the box, kind of like this. Inhale, 2, 3, 4. Exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, 2, 3. What you want to do is take your breath in with your diaphragm. You can go slower than that or more quickly than that. Just listen to your body and time it for what gives you the most stress relief. You can do this quietly when you need a break. You can do this to also help with anxiety, and some patients use that to slow their breathing as they're preparing to go to sleep.
Mm-hmm. Yeah. And if I didn't already mention, it's also something you can do with your care recipient. Mm-hmm. Here are some links to some free guided relaxation exercises. Some of them might be breathing or a body scan. Please check out the links. And then here is a link to the big list of self-care activities, which is from the Dialectical Behavior Therapy Workbook. It has so many ideas of things that we can do to just help take care of ourselves, have a little bit of maybe some me time. And I mean, the list is not complete. There's so many more. And you can also just look online for different self-care strategies or come up with your own. Here are some resources that I had mentioned in the beginning, where we kind of gathered some of our information in addition to our own personal and professional experiences. Family Caregiver Alliance is a big one. They actually, please visit their website. They offer so many different services. They also have videos, webinars on caregiving, dementia, self-care. So please check them out. AARP.org is another one. Mental Health America, as I mentioned, they have a free screening tool for caregivers there to kind of just sort of see where you are on that stress and burnout scale or spectrum. Caregiving.org is another resource. Alzheimer's Association, as I mentioned earlier. Peninsula Family Services is another one. My understanding is that they have some excellent resources for and services for older adults. So please check them out. I believe one of their services includes, like a peer support, like home visit. But please check them out to find out, more specific information. So here at San Mateo Medical Center, we offer through the Integrated Behavioral Health Clinic, the clinic that we are a part of, we do offer some short-term solution-focused brief therapy. And if you have a primary care doctor at the Innovative Care Clinic, which is the adult primary care. You can talk to them and they can send a referral to us. You're also welcome to come to any of our wellness classes that are on various topics, such as like general stress management, managing mood, facing worries and fears, and we have Tai Chi classes, breathing and relaxation class, sleep health, chronic pain management classes. Those are free, no appointment needed. You can just drop in. It's usually held at San Mateo Medical Center on the second floor in the conference room. And we also have a social worker here, Jen Blankaluz Hansen, who is incredibly supportive. And she is also through the adult primary care clinic. We have the Edison and Clinic and Ron Robinson Senior Center here at the hospital, first floor. And we also have the chaplain, Cindy Doyle, who is also incredibly supportive if you're wanting to just talk to somebody. And she's a non-denominational chaplain, so works with all faiths. And then just wanted to make a mention of some phone apps, AARP Caregiving, CareZone, Alzheimer's Caregiver Buddy, and Pacifica. These apps can sort of help with organizing medications, appointments, coordinating with other members of the caregiving team, whether it's family, friends, neighbors. And there's also some reminders to take a time out for a breathing exercise or some sort of self-care activity. And then finally, again, we wanted to just express some gratitude for all that you're doing. And yes, every minute of every day, because it is, caregiving is, as we mentioned earlier, you don't often get breaks. So thank you so much for making the choice to engage in this heroic responsibility.
Yes, thank you. And please take good care of yourself as well.